Hi everybody, this is Dr. Hinson. I am coming to you today because I wanted to make a little video. I was in a running store the other day, yesterday, and started talking to some people there. Just was with my wife while she was buying running shoes, and one thing led to another. We started talking about some common running injuries. So I thought I might mention a little bit about that today. We can make future videos that go into a little more detail, but there are three really common things that I see in most runners, and you'll find a lot of these like Achilles tendonitis, plantar fasciitis, even a Morton's neuroma. Those are some common things that I've seen here in the office and had success helping. But I kind of wanted to give you a little bit of an idea of what those are and why they create problems for people. So we got a really good foot model and leg model today. So a lot of times when you see people with Achilles tendonitis, they feel that pain down in the Achilles in here. And one of the things they'll complain of is that this feels real tight or sore. And so what I try to explain to them is that a lot of times, let's use this leg here, a lot of times the soleus muscle, which is right in here, that becomes your Achilles. So you have your calf muscle, then you have the soleus, and the soleus usually is right before you get to that curve in the lower calf. That muscle attaches into the Achilles, and many times that gets very tight. And so the common idea is that people want to stretch that out because they feel like, hey, this will, makes it feel better, it makes it feel good. The problem, and we'll get into the whole stretching here in a minute, but that Achilles tendon comes down and attaches right into the heel. And a lot of times, because this gets tight, it'll start to kind of pull the heel backwards, and it will begin to stretch the plantar fascia. So that's one of the things that causes plantar fasciitis. The other thing that you'll see really common that causes plantar fasciitis is there's a muscle that actually attaches way up in here and comes all the way down and almost acts like a sling to the inside of the arch here. And what will end up happening is that muscle's job is to kind of help hold this arch up and support it. And that muscle will malfunction many times because of poor adrenal function. As in applied kinesiology, as some of my patients know, we always talk about the muscle-organ relationship. And for this particular muscle, as well as the muscle I just showed you with the soleus, those are muscles associated with adrenals. So that's why people who have a lot of stress in their life, if they're not sleeping well, they're not eating well, or they're not getting enough of the raw materials the adrenals need to be able to perform all the different things the adrenals do in order to help our bodies, then they can start having muscle dysfunction because of overtraining or not getting enough recovery time. And so when that muscle malfunctions, it's very common to develop trigger points in and around the shin. So if you think you have this, if you find the shin bone here, don't go back here in the calf, but if you just go to the inside here and just follow along the bone, you might feel little sore spots along that pathway there. And if you find those and rub them out and massage them, that can provide you some relief. Most often what you'll find in that is that this muscle will malfunction, this tibialis posterior muscle that holds the arch up, it malfunctions. So there's a bone that muscle attaches to here in the foot, and sometimes that bone will drop and it will have to be manipulated or put back in position. The other thing that we see quite a bit is there's muscles on the outside of the leg here called the peroneus muscles. Those muscles also stabilize the outside of the foot, and they actually come down and around and attach all the way into here, okay? And then some of the peroneus muscles also attach to the outside of the foot. So anytime you have muscles that are malfunctioning here, you'll feel some pain here. You might feel some pain if you follow the fifth toe right up to there. Okay, there could be some little trigger points or sore spots. But a lot of times these muscles provide the stability on the outside of the leg and the ankle. And the last thing you'll see pretty common is the big toe flexors. Okay, so flex your toes down. The muscle that allows that to happen is called the flexor hallucis, and you have a flexor hallucis longus and brevis. But basically, these muscles actually contract in here, but also one of them begins all the way back up in here and comes all the way down the leg into the foot. So a lot of times what I see in situations like this is that people will try to, when they have Achilles tendonitis or plantar fasciitis, they try to stretch this out, and they try to make that, stretch that and rub it and massage it and all that stuff. And some of that might provide some temporary pain relief, but it's not really the true cause. Oftentimes we find that you've got misalignments of the heel where the Achilles tendon attaches to, and then you have misalignments on the inside of the arch here, as well as other foot bones that can be misaligned. So the one thing I'm finding a lot of people will do as well, they try to use orthotics, and orthotics will provide some temporary pain relief, but understand it's not fixing anything. It might take away your pain, but it's actually not fixing the cause of why your foot's having problems. Back to stretching. When someone tries to stretch their calf, their Achilles, things like that, what they're doing is they're pulling those muscle fibers apart, which will delay the healing quite a bit and may prevent the healing altogether. So what you want to do, and we can address this in another video, is you want to do things that will help strengthen those muscles of the foot. So what I would tell you is if you have some of these pains, look for trigger points back up along here. So you find that bone in your knee, come on the ins, here's the calf muscle, go in here, and just find some trigger points in and around here. Same thing on the other side, go the inside of the shin, and you can find trigger points there, rub those out. But the biggest thing I'll tell you is that our feet are designed to absorb shock every time you hit the ground, especially you runners. So it's very common for runners to have foot misalignments that need to be corrected, as well as fixing the different muscle imbalances. So I hope some of this was helpful. If you have any other questions, feel free to email me, text me, or comment on the video, and we'll see you guys next time. Bye.